How do you analyze the advertising budget of a practice you're thinking about buying? In this video, I'm going to give you a couple benchmark numbers. I'm going to give you the benchmark number 2.5, and I'm going to give you the number 15. Keep those numbers in mind, they're important. When you're analyzing a dental practice for sale, one of the most important things is the profit and loss statement, where you have revenues at the top and all of the expenses underneath it. In previous videos, we've talked about the most important expenses being some of the big ticket items, like staff, labs and supplies, the facility costs. The advertising budget can tell you a lot about whether or not the practice you're looking at buying is a good investment, an investment that needs work, an investment that's humming along that can be just maintained as is. The advertising budget tells you a lot about the business health of the dental practice that you're looking at. The number 2.5 is where I want to start. 2.5% of collections is a good benchmark for the average dental practice to spend on their average advertising budget in a year. So if you take top-level collections, multiply that by 0.025, and then compare that with the actual number that practice spent on advertising in a given year, you'll have a sense of whether or not that practice is over-investing in advertising or under-investing in advertising. Now keep in mind one crucial detail. Many bookkeepers will throw any and all expenses that don't make sense into the advertising budget. So if the number you're looking at looks kind of funny or doesn't make sense, it's possible that some bookkeeper somewhere has just thrown numbers into the advertising bucket. Now, the 2.5% benchmark is for the average practice, for the average buyer, in the average geography in the US. And every practice is unique, including the one you're looking at. If you need help analyzing your deal to see if your number makes sense, given the situation you're looking at, please reach out, dentalbuyeradvocates.com, to get on my calendar. But let's talk about a few specifics. In general, I break advertising up into three kind of benchmark buckets. If a seller is spending anywhere from 0 to 1% of collections on advertising and marketing, anything related to getting new patients into the practice, to me, that tells me this practice is either on autopilot or not really trying to attract new patients. Anything from 0 to 1% tells me this practice has not been focused on bringing new patients into the office. Anything from 1 to about 3% of collections tell me that someone in this office is thinking a little bit about marketing and advertising. We don't know whether or not they're effective, but at least they're thinking about it and dedicating some dollars to bringing new patients into the office. 1 to 3% is a good benchmark for the average practice to spend on advertising. Anything above 4% of collections spent on advertising and marketing tells me that this office is highly focused on new patient acquisition. That could be a good thing if they're actively attracting tons of new patients. But if you see collections holding steady through the years and they're spending 4, 5, 6% on advertising, maybe they're having trouble keeping the new patients that come through the door. The second number I like to look at is 15. I like to see 15 new patients per month in a dental practice that I'm looking at to see if they have a healthy flow of new patients. Now again, 15 is the average for the average practice in the average geography in the US. A little bit more, a little bit less. Whether or not I get concerned, it can be more about trends and what I see in collections and expenses. At least 10, 15, 20 new patients a month tells you that this practice has a good reputation and acknowledges the reality that many active patients move, die, try a new dentist, and so some incoming new patients are necessary to keep the practice at least maintaining the same level of production and collections as they have in the past. 15 is a good proxy to tell you whether or not a practice is healthy in what it does for advertising and marketing. In addition to looking at the benchmark numbers, feel free to ask lots of questions around the advertising here. While I've given you the 2.5 and the 15 benchmark numbers, every deal is unique. And sellers love talking about what works in their office in terms of marketing and advertising and what doesn't work, and, this is more common, what they don't know. It's very common in the advertising and marketing world to have a sense that something's working, but not know exactly. Is it the mailers that are making the difference? Is it the new website? Is it the patient referral system? What is it that's driving new patients? The doctor that you're talking to may not have a perfect and exact answer, and that's okay. What you're looking for is whether or not they have a sense of what they do in terms of marketing, what they do in terms of bringing new patients into the office. Questions around marketing and advertising can tell you a lot about whether or not a seller's been engaged in the business side of running a dental practice. While analyzing the marketing and advertising budget in a dental practice purchase may not be the largest number that you look at, there is a lot of good information here that you can uncover to know whether or not the practice you're looking at is a healthy business, a business that's okay, or a business that's going to need a lot of work to really get off the ground and get moving. As you analyze the advertising budget, keep in mind the numbers 2.5% of collections and 15 new patients a month, but also keep in mind that every practice is unique. Every situation has a story, and you can uncover that story to know what you're stepping into as the buyer of a dental practice. Reach out if you'd like some help to understand your situation. Go to dentalbuyeradvocates.com, where you can get my book for $2, listen to the free podcast, find a course, and other free resources. I'd be happy to help, and I wish you good luck.